the doctors are on strike. But this time it's the consultants, not the junior doctors. Let's talk to Isabel Hardman, assistant editor at The Spectator. Isabel, very good morning to you. Thanks for joining us.
Hi there, thanks for having me on.
I mean, a difficult time for the NHS, I suppose, would be a bit of an understatement. The British Medical Association say that they're left behind, that accountants are making more money, lawyers are making more money, engineers, they're all making 6 times more money than they were, and the consultants have somehow fallen behind. They're going to struggle to convince the public that they're badly off, aren't they?
Yeah, I think it is quite a hard sell given how much higher average consultant pay is than average public sector pay, and indeed the wider average pay in this country. And the British Medical Association is one of those trade unions that enjoys probably more respectability than some others. Obviously, doctors enjoy much more sympathy than, say, train drivers when they go on strike. But over the history of the health service, the BMA has not always won its battles with the government over pay and conditions. In the 1970s, for instance, it ended up being nicknamed the British Money Association because it had got its position in the strikes then so badly wrong. So it is tricky for the BMA as well as for ministers.
Yes, I think so. And also, I've had a lot of communication from quite a few consultants who say they're not going on strike over this couple of days because they don't agree with the BMA, and many people see it as a very left-wing union organisation. It's not an association at all. It really is run by some very left-wing people who would like to see the Tory government kicked out of office and would like to see the Labour government put another 100 billion a year into the NHS.
Yeah, well, this is the risk that the BMA runs, is that actually it loses the consent of its own doctors for the strikes. And that happened back in 2016 with the junior doctors' strike, where a lot of junior doctors were horrified to discover that the red lines of the Junior Doctors Committee were not their red lines, which were on safety rather than money and causing disruption to the government for disruption's sake, basically. And it's reasonably well accepted within the medical world, certainly within healthcare circles more widely, that the BMA tends to have, as you say, the more militant end of doctors working in the trade union. That's partly a function of who is attracted to work full-time in a trade union.
Yes. And what about the junior doctor strike? It just finished, I guess, on Tuesday, really, didn't it? After 5 days. Presumably that made the waiting lists even longer. Presumably that caused an awful lot of people to not be able to see their doctor for particular procedures. And did it have any effect on the government at all?
So I think obviously the government's using it as an explanation for why waiting lists are going up, which they are. They're going to new record levels every time the figures are released, currently 7.4 million, still rising, still expected to rise much further. And I think in this instance, it probably is fair to say that the junior doctors and the consultants striking have caused a great deal of damage to the NHS's ability to clear the treatment backlog, because that's something that NHS chiefs themselves are saying it is causing them real trouble and sort of despair within their own trusts as they try to deal with the pressures that they've got. I think, though, it's worth just stepping back and asking why doctors might be doing this, because generally doctors don't strike willingly. They're not like train drivers who, I think most of us have got used to train strikes to the extent that it's sort of exciting when a train arrives on time these days. But doctors, I think, or at all, yeah, it's just a bonus that you're actually able to get into work. But I think doctors are exhausted emotionally, physically, mentally after the pandemic in a way that probably we haven't given them enough credit for. And, we clapped them during the early days of COVID, but they haven't really had a proper break since. The wellbeing provisions for them are pretty sketchy. A lot of them are being closed or under threat of closure. And I think these strikes are as much an expression of kind of anguish from doctors who really need a bit of help as they are about pay. And I think if there had been a greater acknowledgement of what we were expecting doctors to go through, which was far over and above the normal level of trauma that they just have to deal with in their jobs, day to day, then we might not have been seeing this widespread industrial action.
Yeah, maybe so, but I've often had conversations with people about why the NHS doesn't work, because I don't think there's any doubt that it doesn't work. And I know that we can talk till the cows come home that there are plenty of good people in it, and there are plenty of people who do their jobs very well, and there are certainly people who have good experiences, but by and large, you know, from the GP surgery to the dentist to the A&E departments, which are overcrowded, to, you know, not enough beds for patients, ambulances not working very well, you know, nobody seems to want to accept the fact that the NHS is broken because the NHS broke it. You know, I don't accept that it was simply down to bad government and bad health ministers and bad secretaries of state. I think the way the NHS is run by the NHS is the problem.
What in particular do you think breaks it about the NHS? What are you talking about, managers?
Yeah, I think the managers. I think it's badly run. I think if you were to look at how individual hospitals are run, they're not run well. If you were to look at how individual trusts are run, they're not run well. Priorities don't seem to be towards the patients, you know. It seems to me they've got too many employees who are not working in the medical side of the business, and they've got all sorts of other priorities going on. And they're hopelessly old-fashioned in terms of how they look at things. You know, their technology is not what it should be. You know, I've had probably experiences in almost 10 or 12 different countries. Every time I used to go on holiday with my kids, one of them always ended up needing some kind of medical treatment. And wherever you were in the world, from Mexico to Spain to France to, you know, Italy, it was always better. And I know you might have had to pay a little bit of money, but it just seemed easier.
So I think there's a number of things there. In terms of management, I mean, it's really interesting because actually the NHS has far fewer managers than other comparable European health systems. It's quite an undermanaged service. And I think that's one of the issues, is it's very easy for us to have managers as sort of the bogeymen in this. But having just written a book on the history of the NHS, I was fascinated by the fact that it was Margaret Thatcher who introduced this layer of management to the NHS, because she commissioned a report by Roy Griffiths from Sainsbury's, who found that, I mean, he had this famous phrase, which was, if Florence Nightingale were walking the corridors of a hospital, she would be asking who is in charge, because management before then was so haphazard and old-fashioned. So, you know, managers are not a sort of statist Labour invention. They're a free market Thatcher invention. And one of the problems is that we don't actually have enough, so they're quite thinly spread. You know, potentially the management is poor quality. There's definitely an accountability problem in the NHS that, you know, if you fail, you often just get moved somewhere else.
Yes. I mean, I've got lots of people who I speak to on a reasonably regular basis who've either worked in the NHS or who still work in it, at sort of nursing level or even at a doctor's level, and they talk about there being still a relative lack of accountability of stock being bought and sort of left in stock rooms and cupboards and never used. You know, stuff that they don't need to buy, they pay too much money for medicine that they should, you know, all of those things. And I just think it's wrong to continually blame politicians when clearly, if you were in any other organisation, you would look at the organisation and say, well, what are you doing about this?
Yeah, and I mean, I think that the way in which the NHS has learnt to function has been, because it's such a political and centralised system, it is a bit like a football team that needs a coach the whole time, in that if politicians take their eye off the ball, the NHS can quite easily slip into quite lazy ways of performing. Now, the flip side of that, obviously, is that politicians don't help because they keep reorganising the service. They treat it as what Jeremy Hayward, who used to be the most senior civil servant in this country, described as the greatest train set on Whitehall. They like to move the tracks around. And that can be really disorientating because you have these new structures and people have to work out how they relate to one another, and they have to reapply for their jobs, or they get a new job title, a new organisation title. And, you know, the amount of energy that takes up that has nothing to do with outcomes for patients is quite extraordinary. So there is that. And on procurement, the NHS can be really useless, actually. And it's also, you know, it's again, and I don't think the NHS is all about funding. It is underfunded when it comes to capital. So its equipment is outdated, its hospital buildings are, you know, manifestly crumbling. But also the money that it does have, and it has a lot of money, is spent in the wrong place. So we've got a study out today saying that a lot of people are dying with preventable conditions or being hospitalised with preventable conditions, and that's because the model of the NHS as it is at the moment, and really as it was conceived by Nye Bevan in 1948, prioritises acute services, so when you're properly ill, as opposed to when you're starting to show symptoms, you're at an earlier stage of a disease, or perhaps even you haven't developed an illness related to, for instance, obesity, which is obviously a huge issue for the NHS. We don't invest very much in primary care, we don't invest very much in community services, but we do invest a lot in acute, and it means that people aren't seen at the appropriate stage of their journey. And obviously when you're really sick, you cost the health service a lot more. So if we were going to reform the system but not abolish the NHS, which I just don't think the public would weather, then you should be reloading the money from acute to primary and community and preventive services, because that's where you get much better value for money. And patients who actually, like your viewer who you quoted at the start of this conversation, could have been seen in a way that they're able to carry on living their life, rather than feeling like they're suddenly sort of trapped at home in this NHS waiting list hell.
Right, and that is the problem. Listen, we could obviously talk for ages about this, Isabel, so listen, really grateful for your time, but let's have a look at the book. It's out now, Fighting for Life, the 12 Battles That Made Our NHS and the Struggle for Its Future. Love to talk to you again soon. Isabel Hardman, Assistant Editor from The Spectator, thank you very much indeed.